Let's check in on all things medical. Joining me, Australian Medical Association President Dr. Steve Robson. There's a few things to cover. Why don't we start off though? You've got to push on the CDC, so the Centre for Disease Control, which we don't have in Australia. We heard a lot about it in the US. It's going to happen here. You're saying it must be independent. What does that mean? So, as opposed to sort of a government department or even a TARGI, which was sort of very much connected to government, why is that important?
One of the things that we saw across the pandemic, Tom, was a mishmash of different strategies and different approaches from states, territories and the federal government. And I think one thing that would benefit the country would be a unified approach and having an independent body. There are some models around that we can look at, and a little bit, for example, like the TGA as one example, where independent experts can work on policy that informs the way the government approaches things. And one of the key things we want is confidence in the system, for Australians to be confident in a CDC and how it works.
And confidence comes from something that is completely independent of government, that indeed even health ministers won't give a hint to, give a nod to, give a recommendation to. And I suppose that's crucial in a time of COVID where people want to know it's not ever a government's call on something, because that might help them in an election in a few months' time, but it's the right call for a health reason.
I think you're right there, Tom. I think Australians trust medical advice and want to know that their health is being put first by a body like this and not necessarily being played as a political football, as we certainly saw during early stages of the pandemic. So we're hopeful that the model that government comes up with really is one that inspires confidence in Australians and can work well.
And if there's a mistake made, that they're willing to call it out or say, well, that was an error, even if that means that error resulted in, say, deaths or whatever. They will just say, here's what happened and here's how we need to change in the future, not being afraid of political consequences.
I think you're absolutely right. Politicians are terrified of being seen to backflip. We know that medical evidence changes, and health authorities are much more likely to look at new evidence and change their track without that political overtone. So we hope something like that will work.